Another factor for the spread of HIV was the lack of resources the remote community had to educate itself against the disease. This led the NGO to take on various educational initiatives. One program was started to directly impact the learning environments of children at the primary school level, an age group which was particularly at risk for being neglected. As parents were too sick to contribute to the development of their children's schools, classrooms and libraries were added by the NGO, leading to more teachers being placed by the government and language development increasing, which furthered student successes in secondary school. As the health of the community was already dangerously poor, poverty increased, leading to lower rates of students being able to attend secondary school. Also, as the project area is located in a remote area, basic services such as electricity, piped water, and phone network are unavailable, and with overcrowded classrooms with nearly no teaching supplies, it is difficult to entice teachers to bring their services to this community. This leads to a high fail rate of secondary students, further leading to parents not wanting to spend the meager family income on the children's education when achievement is unlikely. One program initiative driven to educate the rural poor was vocational training, offered to children unable to afford school fees in the government system, as well as those having failed out of the system due to hardships at home. Finally, a feeding program was started at the primary school as a pilot program that has since been copied by other schools. Most students were unable to go home for lunch, leading to mass absenteeism and behavioral issues in the classroom due to non-attentive, hungry, and tired students. This made the feeding program a particularly important educational strategy, as it provided a nutritious cup of porridge to all of the students at the primary school each day, increasing the attendance from 82% to 97%. The national exam results also increased from 52nd in 2008 to 7th in 2009 in the district. As the overall health of the community has improved and education services bolstered, the burden of the overwhelming number of OVCs has lessened, and more children are being cared for in their communities instead of caring for their families. Going forward, the issue of how the HIV pandemic is affecting the vulnerability of children needs to be addressed through various measures that consider psychological, educational, and health services. Children of all ages have experienced death, illness, guardianship change, and extreme poverty due to HIV and its destruction of the family unit. This leads to a negative trajectory in behavioral development that continues the cycle of illness, which then leads to more vulnerability of children in future generations. Particular policy recommendations to the government of Tanzania, in partnership with larger organizations and international development agencies, might also include partnership with grassroots civil society organizations, such as Fox's NGO, that are working with the community trying to effect change on an individual level. On the national level, the mental health of students should be considered as part of the services every school offers. Schools should be provided with a counselor to work with the student body as a major problem may arise. If there are students constantly missing school, acting out in class, or showing signs of trauma, the school professional will be able to work with the student, school leaders, teachers, and government leaders to find a solution to the problem. Furthermore, every village should be provided with at least one social worker to help with both counseling of families impacted by death, but to also act as an advisor to behavioral challenges seen in the village, especially with adolescent teenagers that have experienced some form of trauma in their childhood. As part of HIV treatment programs, every CTC should have a grief counselor trained to help people work through learning they are living with a lifelong disease that currently has no cure, and the repercussions that disease may have on their private and family life. By providing mental health experts, rights of children can be better recognized, practiced, and followed through, leading to an increase in community strengthening and structure and breaking the cyclical problem of vulnerability. In addition to mental health, the national government should collaborate with local school districts and village ethics committees, police stations, welfare agencies, and local NGOs to promote education with youth. Government requirements should be raised to require all school-age children to complete secondary education, as currently only primary school is mandatory. Government schools should also be given more freedom to give students more time to complete the required courses, meaning that if a child does not understand subject matter, that student could repeat a school year. These measures would help promote learning and not just attendance at school. Children who are late to enter school due to hardships need to be offered alternative programs in all geographic areas. Currently, one such program exists, and it is only located in a few major cities in the country, when its outreach should be targeted at high-risk populations defined by high rates of illness, poverty, and low educational levels. Finally, the Ministry of Health and Social Welfare needs to genuinely commit to interventions that will help create more access to its healthcare system. Basic health service goals that have been announced at the national level by the ministry, such as a health dispensary in every village and a health center in every administrative ward, should be funded and implemented with a well-thought-out plan of getting it supplied with resources that are specific to each particular area. Examples could include infant HIV tests and more broad-spectrum antibiotics, such as cotrimoxazole, for early HIV treatment in higher affected areas. This laudable ambition from the government of Tanzania, if achieved, would surely improve overall health and further lessen the impact of vulnerability of children in communities like Mufindi.